What problem are you specifically addressing?
What we see and what we're trying to do is how do we educate patients and how do we triage them for low acuity primary care cases out of the ER? How do we route them to a telehealth visit or maybe to self-care at home or to a provider visit in 2 to 3 days?
Hello, and welcome to another episode of Solve, another podcast from Syllable Productions. And I am pleased to welcome Amanda Burry, the Chief Commercial Officer from Infermedica.
Thank you so much for having me. I'm so excited to be here back in person in Las Vegas, closing out the year. It's a wonderful time for healthcare, and it's a really exciting conference to round out the year for everybody.
There's a ton of energy around here, isn't there?
You can feel it. This is definitely a different conference feel than some of even the earlier conferences this year. I think people are getting back into the groove. We're getting more used to being in person. We're all either bumping fists or shaking hands. There's no low grade hand sanitizer anywhere. You know, we all have medical grade hand sanitizer. So it's an exciting time for healthcare.
Yeah, it really is. And for Infermedica too, you guys are really growing like leaps and bounds, right?
I couldn't be more proud of the Infermedica team. We just raised our Series B earlier this year.
Congratulations.
We have been growing, and the team's passion for what we do and our mission continues to amaze me every day. And I'm always really excited every time I get to talk about Infermedica and just about the work that our team is doing that really aligns with our mission, which is to help patients receive more affordable and accessible primary care. In by 2030, there's going to be a shortage of about 10 million nurse practitioners, primary care providers, midwives. And there are hundreds of millions of people across the world that do not have access to basic health care. And our mission is to really help triage those people to the appropriate level of care and ensure that they are being able to receive care if they're seeking care. That is really the mission of the company, and we all live it and breathe it every day.
Okay, so that's the mission and sort of the elevator pitch. Talk to me about the problem. So you sort of mentioned access. Access is a big thing. Triage, that's a big thing. But what problem are you specifically addressing?
Yeah, I would look at our problem into two specific areas. One is many patients are using the ER like their primary care provider. We know even post-COVID now that there are abundance of overburdened ERs. We see a lot of the issues now with RSV happening with children, and it really puts a burden and a slowdown on the access to care in the ER when patients are leveraging it as a primary care activity. And so what we see and what we're trying to do is how do we educate patients and how do we triage them for low acuity primary care cases out of the ER? How do we route them to a telehealth visit or maybe to self-care at home or to a provider visit in 2 to 3 days? I think being able to use the ER or the ED for what it's meant for instead of people who are coming in for a sore throat or a sprained ankle is really going to help alleviate a lot of that burden. So that's really challenge number one. I would say challenge number two is how do we keep patients within that healthcare system? I've been talking a lot during this conference about the 3 E's that I'm focused on: experience, education, and engagement. And we talk a lot about patient experience in healthcare, but during this entire conference, my healthcare system back in Chicago has never once pinged me to ask me how I'm doing, but Nordstrom's has asked me 4 times if I want to buy those items in the shopping cart. And so the more that we can educate patients and engage them around the day-to-day activities of their healthcare, the better the experience for the patient, which will also be better for the provider. And so our second challenge is how do we keep those appointments and those patients within that health system?
Right.
Not necessarily within the 4 walls of the health system, but how do we keep them engaged so that they become loyal and build a relationship with their healthcare system? Right. So we do that through our triage platform, which keeps them pre-appointment and post-appointment within that healthcare system and within that ecosystem of their local community per se.
So you're essentially developing a longitudinal relationship with the patient on behalf of their provider or their health system.
Correct. We work with hospitals, health systems, payer networks, telemedicine companies. Currently today, we're in about 30 countries and translated into 20 languages. So as a company, we really focus on healthcare on a global level, but also then locally, we're helping different countries and communities speak and engage their patients in the manner in which they're used to.
Now, you've been the chief commercial officer for about 6 months, if I recall correctly. Is that right?
Yes, I joined the company in June of 2022.
So what's the last 6 months been like for you?
Oh, wow. The last 6 months have been some of the most rewarding of my career. So Infermedica is based out of Wrocław, Poland, and we are the largest technology company in Poland, which is really exciting. And it has been a really eye-opening experience, I think, for me over the last 6 months to see that healthcare challenges that we see here in the U.S. are the same, if not, in some cases, not as great, depending on the way that medicine is delivered and care is delivered. But it's really been eye-opening to go and meet with our various customers in the UAE or the Middle East, or even some of our customers in Eastern Europe and the DACH and Germany regions. We all have similar challenges in healthcare. It's just locally, how do you solve them for that particular culture or that environment? So the challenges aren't necessarily too different. There's still access issues. I think somebody just told me a stat earlier that 80% of patients are still trying to get in for care via a call center.
Mm-hmm.
So triaging people through that call center, but we know that there's limited call center resources and nurses. That doesn't change whether we're dealing with a customer in Australia or in the US. It's a similar challenge. It's just locally, how do you solve for it?
So you just closed your Series B this year. Sort of what's the status of your solution? Where are you today and where are you going in the next 12 to 24 months?
Yeah, and our roadmap to me is always exciting. When you work for healthcare technology companies, you hear about these roadmaps in the future. And I think the important thing that we're focusing on is looking at our medical guidance platform. How do we use that underpinning to also power other solutions that our customers might have? We know that we're one slice of what they're trying to accomplish. So how do we make our solution flexible and ingestible so that they can use it, whether it's in a call center, whether it's in a mobile application, or in an electronic health record like an Epic? And so for us today, it's that first part of triage, but more exciting is how do we close the loop on that solution? So later in this year, you'll be hearing about us coming out with our follow-up solution, which is how do we check on the patient post-appointment? And I think that's part of those 3 E's that I talked about is if you just left an appointment and it's 2 to 3 days later, wouldn't it be great to receive kind of how are you doing? Smiley face, not smiley face. Are your symptoms persisting? Are you taking your medication? Do you think you need to reschedule an appointment? Or are you feeling, much better? I think that next part is really what I'm excited about for our business is how do we continue to close the loop with patients so that we're not just managing sick care, but we're managing the overall experience and the health record of that patient from start to finish.
I'm curious, being an international company, that sort of roadmap that you just sort of outlined, or that potential future, because we never know ultimately where it's going to be, that sounds to me almost like an American healthcare roadmap. But to your point, you said that most of the world is experiencing the same troubles and experience issues. So who drives that? Where does, is there a dominant, is the American healthcare system so big that that's really what drives the product roadmap, or is it other things?
I think it's a combination of our 100+ customers globally. We're very lucky to work with some of the best customers around the world that give us insights and feedback into that product roadmap. So our teams are very open and working with our customers to ask them, what do you think about this? And maybe somebody in Spain says one thing and in the US they say another, but we try to connect the dots together to create kind of that umbrella across the globe of what would work and where. Now, don't get me wrong, in some countries there are challenges that our singular roadmap will not solve for. But I think the important thing is we've created APIs that allow for flexibility. so that you can really craft and create those workflows that are meaningful for your business. So the way somebody like a Microsoft, one of our premier partners, would leverage us within their chat solution or their HealthBot solution isn't necessarily the same way a partner like a Everyday Health would be using us.
Right.
But I think the idea is the work and the dedication that our 60 plus clinical team members put into the medical guidance platform on a daily basis can be flexible across those different type of customers, whether they are a large insurance provider or maybe they are a small rural health system in the US. So the way that Allianz uses our technology in Europe is much different than, let's say, a Microsoft would use it here in the US. But somehow our teams are able to connect the dots. That is done by much smarter people than me. I just take what they give me and go out and talk about it. But we're really lucky to have those strong product leaders and those strong clinical support teams to be able to help us connect the dots globally for our product roadmap.
As the Chief Commercial Officer, what's your biggest challenge, or what are your biggest challenges?
What keeps me up at night?
Yeah, what keeps you up at night?
So what keeps me up at night is our customers and our people. I have always really focused during my career on putting customers at the center of what you're doing. And in healthcare, all of the companies that are here at Health Today have similar challenges where they have their customers they're serving, but most importantly, the patients and providers. And so I always think, are we doing the right workflows for the providers? Because providers somewhere along the way the last couple of years, and you could probably appreciate this, kind of got forgotten about. And we talked a lot about the patient experience, but we didn't talk as much about the provider experience. How do we take some administrative burden off them? So I think about that. And then most importantly, I think about our people. I think coming out of the last couple years and this kind of new world we're in where people are still working remote, not everybody has gone back to the office fully. But I also think there's a different expectation of people, the way that they balance their lives, the way that they commit themselves to the work. And so I always want to make sure that we are living our mission every day as an organization and that my teams feel comforted that I'm there as well with them in the trenches, answering late night emails, supporting them on calls. So I really focus on the people. That's the most important part of my business as well as our customers.
Based on the geographic distribution of your customers, I have to believe that you don't get very much sleep.
You would be right in that. Somehow I don't require a lot of sleep. I don't know where I get that from. I think my mother actually passed that down to me. But she didn't require a lot of sleep either. So yeah, working European hours has its benefits for sure. So I get up early with the teams and support them on calls with customers. And then we have just such an amazing base of customers that make themselves available to us, share their data, share their challenges. And so that makes it rewarding no matter what time of the day it is.
Right. If you were having a conversation with somebody that wanted to know what it was like to work in the healthcare industry or healthcare tech, and they were sort of looking for advice, what advice would you give somebody who wanted to get involved in doing what you do?
So back in 2004, 2005, when I got into healthcare tech, none of my friends knew what it was. They were in banking, they were in retail, they worked for, much different companies. And they're like, what is healthcare? And I grew up in a family where my mom ran a healthcare business from our home. So I was always surrounded by it. And I would say that if you're really looking for purposeful work, mission-driven work, I think health tech is the perfect space. And we need people from those other industries, right? I mean, it has been a very challenging week for many healthcare or a lot of technology companies with layoffs. And, the people that are doing cybersecurity and IT, like we need their help in healthcare, right? Like it's really an all hands on deck mission at this point.
Right.
And so I would say, maybe start with an early stage company, get your feet wet, learn all of the different aspects, and then, branch out and grow your career into the various areas that you want to focus on.
You brought up the sort of the current financial struggles that many countries are having. How is that having an impact on your business? At least what I read in the headlines as potentially, quote unquote, bad as we have it in the US. A lot of European countries are dealing with inflation that's at greater levels than ours. So how does that plan into the work that you do?
Yeah. So I think we look at, pricing models. I think we look at how do we work with customers. I think many more customers are willing to go a little bit more at risk these days. It's a little bit more comforting to them in terms of not being committed to a hard dollar amount. Now, it's interesting because here in the US, traditionally hospitals and health systems, they want that number and that's the number they want to stick to, right? But I think what you see in other areas of the world is they see a range. They see the interactions that range could bring, or the activity or the engagement from their populations, and they're willing to go at risk with it, right? And so I think we're in a really good spot because we're not one of these technologies or one of these companies that you partner with where we're eating all of your budget, right? We're really helping to perform a really key piece of the workflow.
Right.
But the value to outcome that we're creating is something that our partners and our customers can see. And so I think working with them on a one-to-one basis, creating ROI models, creating value and outcome case studies, things that they can bubble up to their board or to their approving partners to say, this is how we're spending our funds. We're doing a really good job. We've built a value and impact team that is led by a U.S. physician here. And he's part of the Infermedica team, and he works with them and digs through the data, and we are able to show them what those returnables are on the investment with Infermedica, which I think in today's world, if you do not have some sort of ROI model or some way to show your partners what the value is, I think it's very hard to sell whatever type of solution service platform that you might have.
It's interesting. Last question for you. I've been asked a lot of times by younger physicians, how do I get involved in technology and or technology companies? So you talked about having 60 or so clinical advisors or along that line. Is there a role for physicians at Infermedica? And if so, what are they?
Yeah, so we have a great group of physicians and all of them are practicing. So they leave, the ER, they leave the office and then they come to the Infermedica office and they do their work. And we're always looking to partner with physicians in the US or globally. We do a lot of clinical validation work. We do third-party, first-party clinical validation work. And then it's also about writing a lot of those journal articles and case studies where we need that clinical input, because I don't know what it's like to work in an ER on a daily basis, but I'm sure that we have plenty of people on staff that have just come off a shift and can tell us exactly what they experienced, how they treated a sore throat in the ER when that really could have been a telemedicine appointment. And so, yes, we're always looking for unique talent and talent here in the U.S. and in Europe. So they can always reach out to the Infermedica website to learn more.
Awesome. Amanda Berry, Chief Commercial Officer of Infermedica. Thanks so much for being on the podcast.
Thank you so much for having me.
Absolutely.